My name is Rabatsane Kwadiba. I'm going to be presenting to you on the title, Targeting Multiple Risk Factors Reduces Your Chances of Getting Macrovascular or Cardiovascular Disease Better Than Lowering Blood Sugar Alone in Type 2 Diabetes. First, let me define the terms in that title. Diabetes. Diabetes is a condition whereby your body fails to control your blood sugar properly. 2. Type 2 diabetes. In type 2 diabetes, your body fails to use a chemical called insulin efficiently, and we call that insulin resistance. Insulin resistance is usually accompanied by overall shortage of insulin in the body, even though sometimes insulin concentrations may be normal, especially in the early years of diabetes. You may be asking yourself, what is insulin? Think of insulin as a key that unlocks your body parts that need blood sugar as an energy source in order for the blood sugar to enter. Just like your house. If you don't have a key to your house, you cannot enter. So those blood parts or those body parts, they need this insulin as a key to unlock them in order for them to absorb or in order for the blood sugar to enter to them. The next term is macrovascular or cardiovascular disease. The terms are interchangeable. And these are diseases of the large blood vessels of the heart, of the brain, and the blood vessels that supplies your feet and legs with blood. If the blood vessels in the heart are affected, you get heart disease, including heart attacks. Those in the brain, you get strokes, or if it's those blood vessels that supply your legs and feet, you get peripheral vascular disease, whereby those blood vessels get narrow and they may even get blocked. The next is risk factors that increase your chances of getting macrovascular disease. These are conditions or bad habits that increase your chances of getting macrovascular disease. They can be non-modifiable or modifiable. Non-modifiable means you do not have control over them, and examples are age. As you grow older, your chances of getting macrovascular disease goes up. So since you don't have control over that, you will concentrate on the ones that you can control, called modifiable risk factors. And an example is diabetes itself, especially if the sugar is uncontrolled. The second example is high blood pressure. High blood pressure, it makes it hard for the heart to pump blood into the blood vessels if they are under stress of high blood pressure. The heart will get strained from working too hard, and then even as time goes on, the blood vessels themselves can get damaged. And now, the other risk factor will be the blood fats or lipids or cholesterol. If they're high, they also increase the chance because they get deposited inside those large blood vessels and they accumulate with time, narrowing those blood vessels. The other risk factor is smoking. Smoking increases your chance of getting macrovascular disease, and so on and so on. So as I said, diabetes is a risk factor of macrovascular disease. And in fact, people with type 2 diabetes have higher chances of getting macrovascular disease than people without diabetes. So over the years, studies were done to come up with ways of reducing macrovascular disease in people with type 2 diabetes. And the strategies that were used, the first strategy or the first studies, they actually targeted lowering the blood sugar as low as possible, even to the levels of people without diabetes, to see if that alone can reduce macrovascular disease. On the other hand, other studies, they targeted the multiple risk factors that I was just talking about, those modifiable ones, like high blood pressure, lowering lipids, and so forth, on top of lowering blood sugar, to see if that strategy can reduce these macrovascular complications better than if you are just lowering blood sugar alone. And first I'll start with lowering blood sugar alone. One particular study called ACCORD, actually it aimed at reducing the blood sugar levels to the levels of people without diabetes. And what they found was that the strategy does not work that well. They did not reduce the risk of macrovascular disease significantly, while on the other hand, they found in that study that they increased the risk of death or mortality in those patients. And the reasons why the risk of death or mortality increased in those patients are still unexplained today. Now, what do we learn from that? Is that about as far as lowering blood sugar, we have to individualize blood sugar targets. For example, somebody who is young, like 40 years old, they've just been diagnosed with diabetes. They don't have a lot of complications. You can try to lower the blood sugar as low as possible, as long as you don't expose them to the dangerous side effects of medications such as dangerously low blood sugar levels. For somebody older, 90 years old, a lot of complications, they've been having diabetes for a long time, it's not worth it to try to aggressively lower their blood sugar to such levels. You may actually end up increasing their death. So, now, how about the other strategy, where now you reduce multiple risk factors at once? A study called STENO2, they actually did that. They targeted risk factors like high blood pressure, lowering lipids, and even giving patients aspirin. And aspirin is the drug that reduces the chances of getting blood clots in those large blood vessels. And what they found was that if you try to target multiple risk factors, you have a better chance of reducing cardiovascular disease. In their study, even though only 15% of patients reached their blood glucose or blood sugar targets, they were able to significantly reduce macrovascular disease in those patients. So what do we learn from this? Reducing multiple risk factors works better at reducing your chances of getting macrovascular disease than targeting blood sugar alone. So what is your take-home message? Discuss with your doctor. Your doctor should be your partner. Your doctor is your partner, or your group of healthcare professionals that work with you in this diabetic journey are your partners in reaching your targets. Discuss with them. They will advise you. Together you come up with strategies of reducing these multiple risk factors in order to reduce macrovascular disease.